Good morning, everyone. It's 8:30. I'm going to go ahead and call the Health Subcommittee of Appropriations to order, and we'll go through our tracking document and note and talk about just the changes that were made from the governor's recommendation. But before I do that, I want to give a shout out to our Cracker Jack budget office with Martha and Teresa and the entire staff over there, and especially Tara, our budget analyst. They've worked many hours to get us where we are today, and I want to say thank you to them and the committee members as well. So I'm going to go ahead and begin. 17.7.1 is just a language change. This is emphasizing future plans for data at a rural health center. 17.1.15, this is language also. This is, we hope this will give us some more transparency with our managed care contracts and a little better feel for what's going on with some of those things. 17.4.5, this is eliminating the money that was placed in there last year for the startups for the FQ8Cs. And then the next item, 17.4.6, adds the funds for 2 startups for a primary care and a behavioral health center startup. 17.4.7, this is providing funds for a full-time position to coordinate donated dental services. The Dental Association has been doing this and has donated several $100,000 worth of free dental care to citizens, and this coordinator helps that program to work, and it's a really good return on that small investment there. 17.4.8, this is the money that goes in to annualize the funds to oversee the competitive bid process for the Rural Health System Innovation Center. And then the next item, 17.4.9, is $250,000 to provide the funds for the startup. The RFP for this should be completed in December of 2018, and then these funds would be there to begin the full development and startup of the rural center. Under ABD, this is 17.7.1 is just a truing up of that number there, minor adjustment. 17.7.4, this is to provide increase the personal care needs allowance for nursing home residents by $15 a month, pursuant to House Bill 2006 that was passed in the 2017 session. So it would go to $15 an increase there. 17.7.11, this is funds to increase the reimbursement rates for adult day health centers. 17.7.12, provide, this is something that will affect all the hospitals in the state that accept Medicaid. This would be funds to increase the triage rate by $10 for urban hospitals and $20 for rural hospitals. This is now, if somebody shows up at the emergency room and they're treated, but when the claim is examined and they determine that it's not a true emergency, they're paid a flat $50 rate, which is not very much, and this would give them an increase in that. We've got it here under ABD, and then it'll be over here under LIM, and I'll point that out in just a minute. 17.8.1, increase funds for the growth of Medicaid based on projected needs. We're saying no there, that we feel like they have enough funds in there to handle that without an increase. 17.8.7, this is the other part to the increase in the triage payments that I mentioned just a minute ago. 17.8.8, provide funds to increase the reimbursement rates for the Marcus Autism Center to cover the costs of treating children with autism with the most significant needs. We were told that with the new coding and the rates that it would be a big hit to the center there, and we're suggesting $568,000 to help offset that. Under physician workforce, 17.12.1, it's recommended 122 slots. It's really, and we're recommending 99, which is just a truing up in the actual number that's needed there. 17.12.2, This provides funds to the St. Joseph Candler Hospital for 2 rural surgical fellowships. 17.12.3, this provides funds to the MCG at Augusta University for 6 new fellowships. We're hoping that this will enable us to retain and bring in some of the brightest doctors and get them to stay here in our state with us. 17.12.4, this provides funding for the Gateway Behavioral Health for the 2nd year of the startup for the psychiatric program there, and this will be the last that we had obligated the state for on that. 17.12.5, this is, it looks like it's new money there, but it's actually being transferred. This is transfers funds from the Georgia Board of Physician Workforce Physicians for Rural program for the Memorial Accelerated Track program. It actually takes 2 contracts and just puts it into one budget program, makes it easier to administer. 17.12.6, this provides funds for the statewide residency recruitment fair that we used to have and was eliminated back when the budget got so tight. $40,000. This is to help them recruit residents all across the state. 17.15.1. This was that a cut there of the $180,000 that was moved up to the 17.12.5 that I mentioned just a second ago. 17.15.2 provides funds for insurance premium assistance for physicians with a practice in underserved counties that currently have 1 or less physicians. And just to remind you that there are 9 counties in this state with no doctors, 4 counties with only 1 physician. Georgia Drugs and Narcotics, 17.18.2. This is a slight salary adjustment there for these people. They're post-certified, and they are ones that are involved in working on this opioid epidemic. And just recently there was a big arrest up in north of Atlanta, and they were involved in this, and we hope that's going to help us to turn the tide on some of this opioid problems that are out there. 38.1.4, there's a cut of $100,000, but that was some one-time funds that was for this maternal mortality study that has been completed and is no longer needed. And then the next item is important, 38.1.5. This provides funds to address the maternal mortality in Georgia. Georgia has the worst rate of maternal deaths post-childbirth in the entire country. We're recommending $2 million to get that moving in the right direction there. 38.1.6, provide funds for the Sickle Cell Foundation of Georgia for sickle cell outreach offices to provide access to care and reduce unnecessary emergency room visits. 38.1.7, provide funds to the Georgia Cancer Control Consortium to fund the Georgia Center for Oncology Research and Education, that's CORE, and also the 5 regional cancer centers there that are scattered throughout the state. 38.1.8, provide funds to implement the diabetes prevention program in the 5 counties with the highest need, hopefully keep people out of the emergency room. 38.4.3, this is language saying just to contract with the Trauma Network Commission to reinstate funding for the 10 regional emergency medical services training positions. 38.7.5, this transfers funds from the Office of Children and Family program for the Emory Autism. There again, this is where there are 2 different contracts for autism, and this will combine them just into the one program. 38.7.6, this provides funds to increase the occupational and physical therapy rates in the Baby Can't Wait program. 38.7.7, this is an increase in funds to reflect a reduction in the FMAP federal dollars that we receive. 38.9.3 provides funds for the Grady Infectious Disease Program to support retention and care efforts for patients with HIV and AIDS. 38.9.4, this provides funds to improve perinatal hepatitis C surveillance, linkage to care and testing to address the statewide increase of the hepatitis C virus due to the opioid epidemic. 38.11.1, this is transfer funds to the Infant and Child Essential Health Treatment Services Program for the Emory Autism program that we mentioned, where we were combining those programs into one. And the item 38.15.3, this is under the Trauma Care Network Commission. This is where they will be reinstating those 10 emergency medical regional service positions that they will travel over the state and train EMS folks throughout the state, and they'll do this with the existing funds that they have in there. And that completes the changes that we had on our the budget from the governor's budget there. Are there any questions from members of the committee?
I have a question, Mr. Chairman.
Yes, ma'am.
On this 17.8.1.
17.8.1, okay.
Response for the growth in Medicaid, and there's a no to that.
Mm-hmm.
And tell me again the explanation on that again.
We felt like that we could reduce that there because they have enough existing funds to handle that. Last year there was a $95 million surplus that was left over, and we feel like there's enough in there to handle that without having to add this $7 million back to it. Any other questions? If not, we'll entertain a motion. Have a do pass and a second. Any other discussion? All in favor, please say aye. Aye. Yeah. Any opposed? Thank you. We'll pass that along to the full committee. By the way, the full committee will meet this afternoon at 2:30, so be sure and put that on your schedule. Thank you very much, and we'll stand adjourned.